Hello, guys. This is Vishnu, and I am a part of our team, DRX Pharma for You YouTube channel. So, I finished my PharmD in the year 2019, and then I worked as an assistant professor in Department of Pharmacy Practice, and now I am working as a clinical pharmacist in Antimicrobial Stewardship Department. Today, I am going to discuss with you a very short and precise insight, but yet it is practical rich on drug interactions of acid neutralizers. Now, when we talk about acid neutralizers, from the name itself, we must understand that these are those medications which reduce the acid content in your stomach. So, for example, if you are having gastritis, or if you are having peptic ulcer disease, or if you are having gastroesophageal reflux disease, there are medicines which help in reducing acid production because due to over excess acid, this kind of gastrointestinal diseases develop. But again, this medicines, as we always say, every drug is a poison. So when a medicine comes with some benefits, it has its own risk of side effects and interactions also. So today we are going to talk about the drug interactions of acid neutralizers, which can include proton pump inhibitors, which can include histamine type 2 receptor antagonists, and which can also include antacids. Please remember that I have not listed all the drug interactions of this medicine because that will literally make this presentation too big and it will become too lengthy also. So that is for your personal reference. You can, if you have the app called Medscape, you can simply write the name of any proton pump inhibitor or any histamine type 2 receptor antagonist or any antacid, and you can just go to the interactions column. You will get the list of serious, contraindicated, monitor closely, or minor interactions and study for yourself depending on your requirements. So this presentation is dealing with significant interactions which are clinically significant of acid neutralizing agents. Acid neutralizers can show drug interactions in any of the following ways. There are multiple ways, but here we are dealing with a very interesting aspect of interaction, and that is called reducing acidity concept. Always remember there are a lot of medicines which require acidic medium for showing its activity. Like there is a medicine called levothyroxine, which is given for hypothyroidism. That medicine requires acidic medium for showing its activity. So if you are giving it with an antacid, if you are giving it with a proton pump inhibitor, so what do? They usually reduce the acid content by increasing the pH. Antacids usually increase the pH, and proton pump inhibitors and histamine type 2 receptor antagonists, they usually block the acid production. So as a result, levothyroxine's efficacy will not be seen in the body because it requires an acid medium. So here we are dealing with those kind of drug interactions. We are dealing with those medicines which require an acidic medium for dissolution or an acidic medium for showing its activity. And when we are giving acid neutralizers concurrently, what happens? So acid neutralizers show drug interactions in any of the following ways. Antacids adsorb some drugs in GIT. Please look at this carefully. It is written adsorb and not absorb. Absorb is something else and adsorb is something else. ADSORB. Adsorb means attracting something to a particular surface. So usually this phenomenon is used in antidotes for selected poisoning cases also, because there are some antidotes which adsorb the toxins to its surface and then it gets eliminated through your urine or feces. So antacids have a tendency to adsorb some drugs in GIT. So as a result, those drugs will not be absorbed. So if absorption is not happening, then definitely the plasma drug concentration will reduce, and as a result, the efficacy reduces. There are some antacids, for example, magnesium hydroxide and aluminum hydroxide, they actually make the urine alkaline. So when the urine becomes alkaline, there are some medicines which require acidic urinary pH to be concentrated and show its mechanism. But if the urine becomes alkaline, they may alter the excretion of medications that are sensitive to urinary pH. So either the excretion will increase or the excretion will not happen. And obviously, H2 receptor antagonists and proton pump inhibitors, they alter the absorption of drugs which require gastric acid for dissolution. So as a result of which their efficacy is reduced. So this presentation deals with clinically significant drug interactions of acid neutralizers with various medications. As I said before, all the drug interactions have not been mentioned here. This is just to give you a practical insight into how to study drug interactions. And just to give you, the purpose of this presentation is acid neutralizers are very commonly found everywhere. Like you can get it OTC basis also, you can get it in the wards, you can get it in the ICUs, you can get it through a doctor's prescription also. So what happens is that if you are using some other medicine with it, there is always a risk of drug interactions. So that is why this presentation is having a good scope. If you look at the drug interactions of acid neutralizers, there are some examples given here. Before I go to the examples, please look at the 4 things that I have mentioned below. One is predictable, one is not predictable, one is not established, and one is highly predictable. So this actually means we are looking at the predictability. So predictability actually is identified by how many patients have suffered from this interaction. So it depends on how many patients have experienced this interaction, or this interaction has occurred in how many patients. So based on how common it is, we are determining the predictability. Now, if you go into Medscape or if you go into Micromedics and different platforms where you can check drug interactions, the severity is usually mentioned, like whether it is a minor interaction, whether it is a major, whether it is a serious interaction where you have to use alternatives, or maybe it is contraindicated also. So here it is on the basis of predictability, how much common it can be. So predictable means this interaction occurs in most patients receiving the combination. Not predictable means it occurs only in selected populations. It is not necessary that it will occur in everyone. Not established means we don't have exactly sufficient data to prove that this interaction may occur significantly. But it theoretically has a matter, actually theoretically is a matter of concern. Highly predictable means there is almost a surety that this interaction will definitely happen. That means it occurs in almost all the patients who receive the combination. So this is how we are going to determine the predictability of drug interactions that we are going to discuss now. So first we go to the interaction of acid neutralizers with antivirals. So here all antivirals are not mentioned. That is up to you to check individually. If you can look at various other antivirals and you can check their interaction with acid neutralizers. Here I have selected 5 antivirals, and these 5 antivirals are used in the treatment of HIV. So as you know, HIV is a chronic disease. So whatever treatment is initiated in HIV, it is usually lifelong. So when you are giving a medication to a person who is suffering from a chronic disease, naturally the medication is also going to be lifelong. So in such situations, if there is an interaction which reduces the plasma drug concentration of that medicine, then definitely the efficacy reduces and the severity of the disease may increase. Which means that if acid neutralizers are used with this kind of antivirals, for example, atazanavir, fosamprenavir, rilpivirine, indinavir, and nelfinavir, if acid neutralizers are used with these medicines concurrently, then what happens is that their efficacy reduces. As I said before, these 5 medicines usually require gastric medium for showing its pharmacological activity. So when you are using acid neutralizer, the opposite thing happens. So acid neutralizers reduce the absorption of antivirals that require acid for dissolution, which can reduce the activity of antivirals. And obviously, you know very well, in an HIV patient, if a particular antiviral medication is showing low efficacy, it will definitely signify that there is an increased risk of resistance. And HIV resistance is a very big matter of concern for the global population. So the predictability has been mentioned as predictable. This interaction has occurred in most patients receiving the combination. So we have to be very careful with this. Next, we come to azole antifungals. Please don't confuse it with another kind of azole, that is metronidazole. They are benzimidazole, but people do get confused. So here we are dealing with azole antifungals, itraconazole, osaconazole, ketoconazole. Obviously, ketoconazole we usually don't use orally, systemically, because as you know that it has a very huge risk of hepatotoxicity and other problems. So ketoconazole usually is used topically or in shampoos, but still it has been mentioned. If acid neutralizers are used with these medications, itraconazole, osaconazole, and ketoconazole, it increases the gastric pH. So when gastric pH increases, the absorption of these antifungals will not happen. So for example, if you are using for a particular fungal infection, then the antifungal efficacy will not be established. So this is also a predictable drug interaction. Please remember that whenever we talk about drug interaction, this is a mistake that I've seen in many people when they study. When we look into drug interactions, for example, a medicine has been given in the morning and another medicine has been given in the night. Theoretically, if both are given together, it is an interaction. But it is not necessary that if a medicine is given in the morning and another medicine is given in the night, it will cause an interaction. So we have to see the pharmacokinetics of the individual medicines and at what distance should both be kept. So on the basis of that only, we can determine whether it's a clinical significant drug interaction. There is another interaction, that is acid neutralizers with digoxin. As you know, digoxin is a very dangerous medicine. It is a medicine that requires therapeutic drug monitoring. So acid neutralizers usually reduce the GI absorption of digoxin because digoxin usually requires an acidic medium, and acid neutralizers usually reduce the GI absorption of digoxin. So if we are using in patients who are suffering from selected types of arrhythmia or in heart failure, then the pharmacological efficacy of digoxin may not be achieved. But it is a not predictable interaction because it has been seen only in very few patients, not in a maximal population. If acid neutralizers are used with iron, especially calcium-containing antacids. So if calcium-containing antacids are used with iron supplements or whatever it is, then the GI absorption of iron is inhibited. Please remember all these interactions that I'm talking about apply to only oral formulations and not IV formulations or IM formulations. Because whenever you are taking a tablet or a capsule, it goes into your stomach and definitely acid content is there in the stomach. So if you are talking about parenteral medications, then they do not have direct contact with the gastric media. So we are here talking about only those medicines which are given orally with acid neutralizers, which are also given orally. So if calcium containing antacids are given with iron, they reduce the GI absorption of iron, which is a predictable interaction. Now we come to some anti-cancer medications, which are known as kinase inhibitors. For example, bosutinib, dabrafenib, dasatinib, erlotinib, idelalisib, and lapatinib. So these are actually anti-cancer medications. If acid neutralizers are used with these medicines, again, the same problem. It will increase the GI pH. So the GI absorption of kinase inhibitors will be blocked. And this is a very dangerous condition because Usually kinase inhibitors are used in cancer, and we exactly don't know what is the stage of cancer of that patient. And obviously, cancer is a very notorious disease. So there will be a risk of resistance, and the anti-cancer efficiency or the efficacy will not be achieved. So this is also a predictable interaction. Then highly predictable, we come to a very highly predictable interaction, and that is acid neutralizers with quinolones. So we have ciprofloxacin, norfloxacin, enoxacin, and maybe other quinolones may also be involved that you can personally refer. Acid neutralizers also reduce the GI absorption of quinolones. Then we come to a very interesting medicine, that is Rosova Statin. You can check whether this happens with other statins also. There is actually a very interesting thing that I want to say about Rosova Statin. We usually give it at night time. Most of the statins are given at night time, considering the fact that cholesterol biosynthesis happens maximum at midnight and the least biosynthesis happens at midday. But if you look at the half-life of atorvastatin, rosuvastatin, and pitavastatin, they are having sufficient half-life to be given at any time of the day. For example, pitavastatin, which is the most potent statin, has a half-life of 12 hours. Atorvastatin has a half-life of 14 hours, and rosuvastatin has the highest half-life of 19 hours. Only thing is that you should give at the same time every day. It should not be that you gave rosuvastatin in the morning and then the next day you gave it at night or something. So that is one thing we need to focus on. Yes, the other statins should be given at night time, but it is not at all a compulsory thing for the three statins that I mentioned now: rosuvastatin, atorvastatin, and pitavastatin. If acid neutralizers are used with rosuvastatin, the absorption of rosuvastatin is reduced. So if it is used in coronary artery disease or ischemic heart disease, if it is used in myocardial infarction in which dyslipidemia component is also involved, or if it is used in any cardiovascular condition in which a dyslipidemia component is involved, then the anti-hyperlipidemic efficacy of rosuvastatin may not be observed. So this is a predictable interaction. Then we come to the interaction of acid neutralizers with salicylates. So this is a different type of interaction. So acid neutralizers usually increase the urine pH, and salicylates usually require low urine pH for renal clearance, or proper renal clearance. So what happens when the urine pH increases? That increases the renal clearance of salicylates. But this usually happens only with large doses of salicylates. It is a predictable interaction. So this actually refers to the elimination of a particular molecule. So if large quantity of salicylates are eliminated, then they may not be able to show their pharmacological activity for which they were being used. So these are some interactions that I mentioned here. One is kinase inhibitors. Then we talk about fluoroquinolones. Then we talk about rosuvastatin and salicylates. Now we come to the last two interactions of acid neutralizers. This is tetracycline. I hope everybody knows tetracycline usually have a large list of do's and don'ts. So acid neutralizers, they reduce the GI absorption of tetracyclines. So this is a very highly predictable interaction. So that is why it is always advised that tetracyclines and acid neutralizers should be kept apart, should not be given concurrently. And as you know that tetracyclines are broad spectrum antibiotics. So they are having a huge list of side effects. So they are used only in selective conditions. So this is a highly predictable drug interaction. So as I said before, if acid neutralizers are used with thyroxine, or if it is used with levothyroxine, which is used for hypothyroidism, so the GI absorption of thyroxine will be blocked, as a result of which it will not be able to show its efficacy. So this is actually a not predictable interaction, but still we usually advise patients to take levothyroxine on an empty stomach, and you should keep it at a sufficient time away from taking any kind of beverages or any kind of beverage or any kind of food or any kind of medicine that increases the pH of the stomach. So these are some of the clinically significant interactions of acid neutralizers. And that's it for this presentation. This has been a short video. I will be coming back with more interesting interactions of other medicines. And then we will be having a separate playlist in which you will be able to view the drug interactions of many medicines. So if you find this information relevant, then please do share and subscribe to maximum people. I always personally believe, and that is the motto of our YouTube channel also, that theoretical knowledge we don't provide, because theoretical knowledge is available everywhere. You can get it in books, you can get it through notes from your faculties, you can get it in websites, you can get it in apps, but how to visualize it practically? There are many people who tell me that we study a lot of things in books, but we are not able to remember it. So I always tell people that whenever you study something, you try to visualize it practically, because it is always not necessary that everything that you study in theory, you may be able to see it practically. So to have a visualization is very important. And when you understand things and study, I believe that your memory power will also increase, and definitely you will